When you are writing the NCLEX, there are several things you can do to help you get the most out of your brain so you will pass. In this video, I am going to go over tips that will help you perform your best on the NCLEX. Don't brain dump. Do not write anything on your noteboard until after the tutorial is done and the exam has started. If you write anything before the tutorial or during it, it is considered brain dumping and the exam can be canceled. Be confident. Believe in yourself. Think positively. If you are worried because the questions seem to be getting harder, remember that likely means you are doing well. Hard questions are a good sign that you are passing. If questions are getting harder, that is a good thing. Don't freak out. It probably means you are doing well. Take a deep breath and move on. Since you can only see one question at a time, and you cannot go back to a question once you have answered it, do your best to think about one question at a time. Focus your attention on the question on your screen, and do your best not to think back to previous questions. Maintaining your focus becomes particularly important if you get a lot of questions. Remember that if you run out of time, the last 60 questions you get will be reviewed to determine if you pass. So be sure that you do not lose your confidence when you are getting close to 265 questions. According to the NCSBN website, about 20% of people will get 265 questions. Focus on your test and don't get distracted by others around you, especially as they start to leave. Many students have found that earplugs are a good idea. Even though you cannot bring personal items into the exam, the NCSBN website says that you can request earplugs during the exam if you get distracted. All you need to do is raise your hand and ask the test administrator for them. Read each question carefully. Don't rush. The most common mistake that students make in a testing situation is reading the question too fast or even skipping sections of the question because they are in a rush. Bad idea. Make sure you read the entire question slowly enough that you know what they are asking you. The NCLEX is tricky, so you need to pay attention to what the question is asking. That means reading the question. Sometimes on the NCLEX, they will give you options that fit some, but not all of the information given in the question. If the response does not fit all of the cues given in the question, then it is incorrect, even if it fits most of the information given in the question. The correct answer will be the only one that fits all of the information given in the question. For example, if you are being asked to prioritize patient care, you may be given airway-related options that are expected and therefore less of a priority than an abnormal circulation option. That is why you need to be able to think critically about what you are being asked. If you don't know, guess. Even the NCSBN website tells you that you should take your best guess if you don't know the answer to a question. In fact, they only give you questions that they anticipate that you have a 50% chance of answering correctly. Since you cannot move on without answering the question, you should consider the options, then take your best educated guess. The NCSBN website suggests that you only spend about a minute or two on each question. When you come across something that you don't know, try to focus on parts of the question that you are more familiar with. If you start telling yourself negative things because you feel bad for not knowing something, you'll be more likely to answer this and future questions incorrectly. Remember, I told you that you need to think positively. Think about what the question is asking about in more general terms and try to logically reason how you might be able to eliminate options. Avoid giving up too soon, taking a random guess, or selecting your favorite letter unless you have absolutely no idea what to answer and you have already tried to think logically about it. Budget your time. The test could take up to 6 hours. You could get anywhere between 75 and 265 questions. Even though only about 2% of people run out of time when they take the NCLEX, it is still important for you to avoid losing track of time. Instead of checking the clock every question, try to remember to look at the clock once in about every 15 questions so you can adjust your speed if you need to. That way you won't lose too much valuable test-taking time by frequently looking at the clock. If you do run out of time, the last 60 operational items are used to determine if you pass or fail the exam, which is why it is important to stay focused and not to rush, even if you are running low on time. Remember to focus on each question and avoid getting discouraged as much as possible. Don't change your answer. Once you have selected your answer, submit it and forget it. Research has shown that usually the first answer you select will be the right one. For some reason, we humans like to talk ourselves out of the right answer. So unless you realize that you misunderstood or misread the question, it is normally not a good idea to change your response. Use your breaks wisely. When you get a scheduled break, use the time to do things that will keep you comfortable and focused during the exam, like snacking, using the washroom even if you're not sure you need to, and going for a short walk or doing a few stretches. When you sit down to do your exam, take a deep breath. I know it may sound silly, but taking a deep breath will help you get oxygen to your brain so you can think more clearly. It can also help you to relax. Breathe slow and deep without letting your chest expand. If your upper chest is expanding, you are not breathing deeply. Instead, your diaphragm should be doing the work, which will make your abdomen expand. Try to aim for a count of 6 on the way in, pause, and count to 6 again on the way out. Of course, you can't breathe this deeply throughout the entire exam, but every once in a while, it will help you relax. When you aren't taking a really deep breath, just make sure you are still breathing. Thank you for watching. I hope you are able to think positively during your NCLEX and pass it with ease. Please comment below to let me know if you found these tips helpful. If you have any other tips, please share them below. For more tips, please watch my NCLEX playlist. For more information about how computerized adaptive testing works, I suggest checking out the link to the NCSBN website below.